Hey, Dr. Yates here. I've been treating menopause for 16 years, and today we are discussing frozen shoulder. Frozen shoulder is a frustrating and painful condition that causes the shoulder to freeze up, limiting movement and causing a lot of discomfort. You'll find this happens when tissues around the shoulder joint become thickened and inflamed, which can make even the simplest daily tasks like trying to reach for something on a high shelf or putting their coat on extremely painful. This condition is surprisingly more common in perimenopausal females, and it's something I see a lot in my practice. So how do I approach treating frozen shoulder in perimenopausal women? Let me walk you through my approach. First, balancing hormones is crucial, especially progesterone. It might not be the first thing that comes to mind when you think of a frozen shoulder, but progesterone plays a significant role in reducing tension and inflammation in the body. And when the levels of progesterone drop in perimenopause, that's what they do, it can contribute to the development of shoulder pain and stiffness. So addressing the hormonal imbalance is step one in my treatment plan. Second, we need to add magnesium into the mix. Magnesium is an amazing mineral that helps relax muscles and just the tension overall. I also recommend adding some natural anti-inflammatories like turmeric, ginger, or meadowsweet. These are great in easing the pain and inflammation in the body without the side effects of anti-inflammatory medications. This can help make a difference when combined with the other treatments. So let's get specific. Manual therapy is the cornerstone of effective treatment for frozen shoulder. It is absolutely essential that your therapist works on key muscles that influence shoulder movement and stability. Here's what needs to be targeted. Write this down. Number one, pec minor and subclavius. These muscles are crucial for the rotation and movement of the collarbone, which impacts shoulder mobility. Number two, teres major and subscapularis. These are key muscles that allow the rotation and abduction of the shoulder. Releasing these is vital for regaining full movement. Three, the deltoid muscle. This is the major shoulder muscle. It's important for overall function, and there will always be tight points in there too. Four, your upper ribs. The mobility of the upper six ribs must be checked. These are anchor points for all of these muscles that get locked up. And if they're mobile, it will be hard to restore shoulder movement. Do not forget about the ribs. Now, here's where I'd love your input. Over the years, I've noticed two interesting things about the patients I treat for frozen shoulder, and I'm genuinely curious if anyone else has experienced something similar. One, it's almost always the non-dominant arm that's affected, assuming no injury. I don't have any studies to back this up, but I have seen this trend time and time again. And has anyone else noticed this? If so, let me know below. Number two, in non-injury shoulders, stress levels play a big role. The frozen shoulder isn't caused by direct injury in many cases, and many of my patients seem like they're under significant stress at home, whether it's stress related to a spouse or a child. This seems to be something I've noticed. I don't have any concrete data at all to support this. It's just a pattern that I've observed. Does anyone else resonate with this? Maybe you've experienced it yourself or seen it in others. I would personally love to hear your thoughts. And of course, if you're dealing with the stress, you do not need to post about that below if you don't feel comfortable. But I would love to hear your feedback. I hope this information gives you a better understanding of frozen shoulder in perimenopause and how it can be treated. Because left untreated, this condition can drag on for up to 2 years. But with the right approach, I aim for significant improvement, and I like to see changes within 2 months. So if you're dealing with frozen shoulder, do not wait. The key is early intervention to getting back your active pain-free self.